The federal government has explained why it asked all the states administering the COVID-19 vaccine to stop the exercise at the moment they use half of the doses allocated to them. Minister of State for Health gave the explanation at news briefing of the Presidential Task Force on COVID-19 in Abuja. He said it was to ensure that those who receive their first jab would be able to complete their vaccination.
That is true. We believe that in a situation where we still cannot specifically determine when the next batch of AstraZeneca vaccines will arrive, then I think wisdom only dictates that it's better for us to vaccinate people fully, and so that we can say that we have a pool of citizens that have been fully vaccinated, since this vaccination comes in 2 doses. So that's what gave rise to that directive, rather than just going ahead with just single dose when the full dose should be 2 doses of the vaccine. So I think we felt that it was proper for us in the circumstance to ensure that those who have been vaccinated have been fully vaccinated. I mean, by the time we fully utilize the doses available. Thank you very much.
The Director General of Nigeria's Center for Disease Control assured that the agency was investigating the reported blood clotting in some individuals that have taken the first jab of AstraZeneca vaccine.
So there's been ongoing investigations that we've all been following on a link between, or suspected link between the the AstraZeneca vaccine to certain very rare incidents of blood clotting in individuals in Europe. Now, those investigations are still ongoing, right? Certain EMA has made certain comments. Certain countries, not all European countries, have taken certain actions within their populations. In Nigeria, with every vaccine, we have a parallel system to measure and to monitor any side effects. That is ongoing. It's being managed by NAFDAC in collaboration with MPACDA. And we will continue to monitor patients in Nigeria. You know, every demographic is different. The demographic taking vaccines in every country is different. The interactions between different drugs people are taking. So there are many circumstances that need to be fully evaluated. We will look at the data ourselves here in Nigeria, and we'll take action as needed. I think the critical thing to always remember when you talk about medicines, vaccines, and side effects is it's never as simple as it imagines. You always have to weigh the risk versus the benefits. And once you do that, it becomes immediately obvious that the benefits of these vaccines by far outweigh small risks in individuals. The argument against that is always, if it's in one person, the risk in that person is 100%, whether the rest of the population gets it or not, which is true. Which is why we're obliged to investigate every case that we see and do the best that we can to understand what is going on. So I think what Nigerians can do really is to rest assured that as we increase the scale of the vaccination program, we are also monitoring very carefully not only that, but other potential side effects in our context in order to make the best decisions for our people.
Also, Executive Director of NPHCDA clarified that the AstraZeneca vaccine and Johnson & Johnson vaccine cannot be taken by the same individual.
That is a no, right? You cannot take the AstraZeneca on your left and then Johnson & Johnson on the right. Yeah, so it has to be both doses of AstraZeneca and a single shot of the Johnson & Johnson. We've said on multiple occasions here that there are side effects of these vaccines. Side effects of vaccines are not unique to the COVID-19 vaccines, and it is not uncommon for people who take the vaccine to experience mild side effects. Once they experience these side effects, the correct thing to do is to report these side effects to the health facility where you got the vaccine. There's also the Med Safety app that you can download on your phone and report these side effects. The data goes directly to NAFDAC, and we're following up on these side effects. Anywhere there's a serious side effect, this is investigated to try and establish any causal link between the vaccine and whatever symptoms or sign the client has shown. So one thing that we continue to tell our vaccinators is that even before people take the vaccines, they should be educated on the potential side effects. For those of you who have kids, when you take your kids to the health facility for vaccination, I'm sure you are familiar with the fact that on that day, the kid, you will usually have a mild fever, they might not be able to raise that limb, and they're usually very irritable. These are evidences that the vaccine is actually working. So there is an immune response to the vaccine that has been introduced into the body.
Meanwhile, the chairman of PTF on COVID-19 and secretary to the government of the Federation, Mr. Boss Mustafa, said civil servants on grade level 12 and below will continue to work from home because there were certain red flags that needed to be interrogated further.
There were certain considerations that we want to interrogate further because there are some few red signals that we must deal with before we would communicate to the head of service of the Federation as to when is the appropriate time for them to return. So we are still drilling the issue, and within the next couple of weeks, when we come to a conclusion about the safety of a full-blown opening, it comes with its own challenges. A full-blown opening in public offices, before we take a decision as to when level 12 and below will return to work, we will drill in some few issues and have a clarity of where we are in terms of our control, in terms of our vaccination, so that we do not blow the level of successes that have been achieved thus far.